Hello, everyone. My name is Ari Javdan, and I'm the project manager for the National Consortium of Telehealth Resource Centers. Welcome to the latest presentation in the NCTRC webinar series. Today's session is on connecting closer to home, why broadband and telehealth need each other, and it is hosted by the Telehealth Technology Assessment Center. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth programs. Just to provide a little bit of background on the consortium, located throughout the country, there are 12 regional telehealth resource centers and 2 national, one focused on telehealth policy and the other on telehealth technology assessment. Each serve as focal points for advancing the effective use of telehealth and supporting access to telehealth services in rural and underserved communities. Just a few tips before we get started today. Your audio has been muted. Please use the Q&A function of the Zoom platform to ask questions. Questions will be answered at the end of the presentation. Please only use the chat feature for communication issues with technology or communication access issues. Please refrain using chat to ask questions or make comments. Please also note that closed captioning is available, and that is located at the bottom of your screen. Today's webinar is also being recorded, and you will be able to access today's and past webinars on the NCTRC YouTube channel and the NCTRC website at telehealthresourcecenter.org. With that, I will pass it over to Jordan Berg, Principal Investigator for the Telehealth Technology Assessment Center.
Thank you, Aria. It's a real pleasure to be here today. I'm going to go ahead and share my slides. All right, I think we are working. So yes, my name is Jordan Berg. I'm the Principal Investigator for the Telehealth Technology Assessment Center, which is one of 2 national telehealth resource centers. The other, our sister National Telehealth Resource Center is the Center for Connected Health Policy out of California, and we are the Telehealth Technology Assessment Center with our focus on telehealth technology. We're out here in Anchorage, Alaska. I am a longtime Alaskan resident. I've worked with the Alaskan Native Tribal Health Consortium for the last 16 years. The last 12 years of that has been in telehealth and telemedicine. I get to talk about something that really matters a lot where I live and hopefully matters a lot where you live today, which was talking about broadband and telehealth and how they're really in need of each other. So let's talk a little bit about who TTAC is. So we are your federally funded telehealth resource center through the Office for the Advancement of Telehealth, focused on telehealth technologies. And that's a wide variety of things, whether that's from infrastructure all the way to peripheral devices. So we provide technology assessment resources to our 12 regional telehealth resource centers. We like to say we're a resource center for the resource centers, but we also work with organizations and individuals all throughout the country. This is our team. You can see I'm there I might be wearing the exact same shirt, but I'm there talking about some of our telehealth technology. We have Patricia Navnet, who's our marketing specialist, and then Calvin Ross, who's our technology specialist. So if you've been to any of the regional conferences and seen our tech showcase, these are, you probably have met me and Calvin. Patricia tends to work a little bit behind the scenes. So what are some of the things that TTAC does? So we provide technical assistance to individuals and organizations, as well as resource centers. We maintain a wide variety of website resources, including innovation watches, which are featured articles about telehealth technologies that we think are interesting or might have an impact on telehealth applications for organizations and individuals. We have a variety of special projects that we're engaged with. Right now, we're finishing up our reports for our telehealth technology survey that we did back this spring, and we're actually pulling together some of the conclusions from that. We're going to talk a little bit about the telehealth broadband pilot program today, which is a measurement program for broadband in rural and underserved communities, and so we'll go into that. And we also do something we call the Telehealth Technology Showcase, which is where we travel to a variety of different events with about 9 Pelican cases worth of telehealth equipment and let people try a variety of different telehealth technologies side by side in a vendor neutral environment and really learn about the types of technologies that are enhancing telehealth and digital medicine. But that's what we do in general. What are we doing today? So today, we want to provide you with an overview of some of the key things that you might need to know about broadband in telehealth. So we're going to start with a definition of what broadband is, focusing on kind of some of the key metrics that we want to measure and kind of be aware of. We want to talk about how broadband matters to digital health and to telehealth. We're going to give a little overview of what the state of broadband is within the United States, and then some of the steps that are being taken to measure the gaps in broadband connectivity. And finally, we're going to leave you with a couple key web resources that you can use to further your learning in the space, and then give time for some questions at the end. I wanted to, at this point, kind of talk about who is the audience we kind of wrote this presentation for, and want to kind of set some expectations as to kind of what we're going to learn today. So this is really for telehealth organizations that interact with patients and are trying to navigate how patients connect, and what is really important to consider when patients are trying to connect to services that you are offering or providing. The other thing is this is for telehealth organizations or digital health providers that are actually providing these services to consumers from their home. So if you are either a provider that's delivering care from your home, or if you are supporting providers that deliver care from home. So again, a lot of the topics that we have is going to be focused on consumer broadband and consumer connectivity, as we see that that's the space for the most amount of growth that we really want to focus in on. So I just wanted to set kind of an expectation as to what the broader topics are going to be. So at a high level, and this may be things that most folks already know, but we want to make sure that we kind of start with the very beginning. So we talk about broadband, and what are we talking about when we talk about broadband? Well, broadband is internet access that has two main features. One is it's always on, and two, that it's fast. So, and this was kind of defined in the U.S. National Broadband Plan that was published way back in 2009. So, some of us will remember the days of dial-up internet where you had a phone line and you connected to a phone line through your phone modem, and it made a bunch of noises. And if anybody else was on the other line, it would actually disconnect you from the internet, and you were actually tying up that phone line, and it was periodic. You could periodically connect to the internet, you were periodically disconnected, and it took you 20 minutes to download an image. So that's the opposite of broadband. Broadband is a connection to the internet that's always active, always accessible, and that is fast, for some degree of fast. And that definition has actually changed over the years, and actually, in fact, really recently, as of March, the FCC has actually updated what that standard for broadband connectivity is. So as of the 14th of March, the speeds that are considered to be broadband speeds are 100 megabits per second download speed, and then 20 megabits per second upload speed. So we'll talk a little bit right now about what we mean when we say upload and download speed. So, and we'll talk about what megabits per second is actually first. That's a good thing for us to do. So, information that's moved across the internet is moved in something called bits, which is basically a 1 or a 0. And everything that we do digitally can be broken down into multiple steps and eventually becomes bits, becomes 1s and 0s. And so that's the information that we're moving across. Megabits per second is millions of bits per second. This is the measurement that we use to track how fast an internet connection is. And so megabits per second is millions of bits, and you have gigabits that are 1,000 megabits. So so we'll talk about gigabits and we'll talk about megabits, but they're measurements of speed for connectivity. When we talk about download speed, what we're talking about is your ability to pull information from the internet. So how fast can you download a video? How fast can you pull a document from the internet? How fast can you access images? How fast can you access a web page? That's all based on your download speed. Your upload speed is how quickly can you share information to the internet. So so upload speed is in a video conference like this, my camera is sharing information. I'm also sharing information about my my slides here, and how fast can I get that information from where it's at with me to another location, to the other recipient on the other side. So historically, we've consumed from the internet more than we've shared with the internet. So download speed's kind of been the priority. So, and you can see this is what we would call an asymmetric connection, where the 100 megabits per second download speed is higher than the 20 megabits per second upload speed. So most of the time when you're watching a video, or if you're consuming content, or you're shopping, what's really important is your download speed, your ability to pull in information, read it quickly, and collect that data that you need. Upload speed is something that's more important kind of with the advent of video conferencing. So video conferencing is something where it's important that my audio, my video gets shared across the internet quickly. So one of the things that we really try to focus on is that you can get a really high download speed number, but that upload speed number, especially if we're trying to do live video conferencing, live telemedicine visits, is also really, really important for us to make sure that we're managing and that we are aware of. And just for historical context, so this is the new standard, March 14th, 2024. What was it before March 14th, 2024? So it's actually increased from 25 megabits per second down and 3 megabits per second up. So you can actually see the standard that the FCC's put out has quadrupled in download speed and more than quadrupled in upload speed, which kind of reflects the higher demands that we're putting on our internet connectivity now. And we'll talk a little bit more about what's generating all that demand for internet connectivity in a couple slides here. Continuing our conversations about what is broadband, we should talk briefly just about the different types of ways we can connect to broadband speed internet. Again, broadband is fast, always on internet. So how do we connect to that fast, always on internet? So kind of in order of the speeds that these technologies kind of support, we're going to talk first about fiber optic. So fiber optic is in terms of like deploying networks across the United States, fiber optic is a little bit of the gold standard. It's very, very fast. It can transmit data over very long distances, and it actually uses glass tubes inside of a cable to transmit those bits, those ones and zeros, with little bursts of light. And so we get speeds through the cable that are approaching the speed of light. It's about 70% of the speed of light. So the ability to transfer this information can happen very, very, very quickly. And what we actually see in the little image there is that you actually have a number of these little mini glass tubes that can stretch over very long distances, and these pulses of light are transmitted down those glass tubes, so that you're actually using all the tubes at once to kind of transmit little bursts of light back and forth at really incredible speeds. So what speeds are we talking about when we're talking about fiber? So instead of measuring speeds for fiber in megabits, we're actually we can consider speeds in gigabits. So you can have up to 10 gigabits per second through a fiber connection. Most of the commercial plans that are offered are going to have speeds more in the range of 1 to 10 gigabits per second. But you can see if we look at that FCC definition of 100 down and 200 up, that's more than enough to meet that requirement. Fiber is also really interesting because it's one of the few connections that's actually symmetrical. So it can receive as fast as it transmits. So so your upload speeds and your download speeds should be or can be the same through a fiber connection. So what are the challenges with fiber optic connectivity? most of the challenges surrounding fiber are just around the availability. So according to broadbandnow.com, we have slightly over half of the US communities that have access to broadband speed internet. Now, that will be changing rapidly as we talk about some of the funding opportunities that are kind of rolling out across the United States. And that's one of the things that is being a major point of focus, is actually getting these fiber lines installed to serve these serve more rural, more underserved communities. And this is really our way of getting the fastest speeds to the most people. But again, the fiber doesn't come to everyone's door. A lot of communities are kind of waiting in the wings for fiber to come to their communities. And then when it does come, it will have a substantial impact on the speeds and the quality of internet to these locations. Another common platform or another common type of broadband connection is cable. This is using coaxial cable. It's the same kind of cable, type of cable that actually goes into your cable box. If again, another technology, well, there's been a lot of cord cutting recently. Cable boxes aren't as prevalent as they used to be, but that cable, that coaxial cable that comes into your house for that cable box can also be used to connect to a cable modem, and that provides very fast speeds as well. Cable speeds tend to be in the hundreds of megabits range, up to a gigabit speed that you can get through the cable modems. They're not asymmetrical. They tend to be they tend to prefer download speeds quite a bit over upload speeds, and they generally aren't a dedicated connection. So the cable that comes to your wall can have variable speeds depending on kind of what other folks are doing on that cable network in your community. And I think a lot of us have seen this, particularly during COVID. We would see this kind of fairly often, where when everybody was doing schoolwork or everybody was trying to work from home and are using these consumer grade broadband connections, we would notice a slowdown because of the amount of people trying to access internet resources all at the same time on some of these cable networks. DSL is another technology. It actually uses phone lines, so the copper phone connections that we have. These are typically more affordable. They're widely accessible because the phone lines are kind of everywhere, and most homes have a phone line connection that go into them. The speeds are substantially less. We tend to have about 20 to 50 megabits per second for the speeds, with download, with an upload being between 1 and 5 megabits per second. Now, that should be fast enough for most telehealth applications, but we're definitely talking almost an order of magnitude less than some of the other some of the other connection types that we've looked at. Other key broadband technologies are satellite. We've actually seen there's the benefits of satellite are we don't require terrestrial infrastructure. So when we talk about fiber, we talk about laying fiber, we talk about getting fiber to communities. Well, with satellite, you actually don't need any what we call terrestrial infrastructure or hardware that's on the earth. What we're really looking for is a satellite dish, and sometimes communities are served by large satellite dishes that actually connect to other technologies like cable or like DSL, and that they actually are repeaters. So you have one large satellite dish that's collecting all the internet for a community and actually translating it out to those communities. We see that a lot here in Alaska. But other times these satellite dishes are for an individual residence, and so that each residence is actually connecting to these satellites from these dishes. So this means that you could be really anywhere, as long as you can see where that satellite is in the sky, you can get connectivity. So there are two main types of satellites that are providing connectivity. One is the GEO or geostationary Earth orbit. So these are further away. And what they do is they actually kind of hover over the same place on the planet. So as the Earth rotates at a specific distance away, the satellite is rotating with it. So it's always looking down at the same location of the Earth. And this provides a really stable way to connect with that satellite. We can look up at the sky and see that satellite that's always over our heads. It's a geostationary satellite. This is a long-standing technology. It's been used in rural healthcare and rural, particularly in Alaska. We've had geostationary internet for decades now. The challenge with it is because the satellite is so far away, we tend to have quite a bit more latency, ranging from anywhere from a half a second to a full second for that signal to go all the way out, hit that satellite, bounce back to another receiver, and for that internet connection to kind of go down on its way. So what we end up with is latency, or the lag that it takes for that signal to go into space, come back down, and that signal to be returned. So in video, it's very easy to notice this. We've all had issues where, we try to sing happy birthday over Zoom and everybody's a little bit off because, there's a delay of a quarter of a half a second between all the participants. Well, when you're doing this on satellite, that delay can be up to a second or 2 seconds. So you're not able to kind of coordinate. Most of the time, it doesn't matter a lot for video. It's a kind of an I go, you go, but for just-in-time communications or applications that require low latency, this is a big challenge. The other kind of key satellite technology we need to think about is low Earth orbit. This is kind of an emerging technology. So there are a few providers out there that are providing these low Earth orbit satellites. And so these satellites are much closer to the Earth. They're moving much faster, and they're doing multiple laps they're doing multiple orbits of the Earth really pretty quickly. So they're not the geostationary that we can always look up and see our geostationary satellite. These are always kind of hitting, coming up over the horizon and setting over the horizon pretty frequently. So how do we do internet through those? Well, we have constellations of these low Earth orbit satellites. So overhead, there might be 14, there might be 20, there might be hundreds of these satellites that are overhead at any given time. And by networking these satellites together and handing off the internet traffic from each of these satellites, we're able to build a network of an internet network from these low Earth orbit satellites. What is the benefits from these low Earth orbit satellites? We can support speeds of anywhere from 50 to 250 megabits per second. Starlink's a good example of these. We've actually have quite a few Starlink connections up here in Alaska. We're seeing on average a lot of these connections getting 100 megabits per second download speed. We see we see a lot less of upload speed from these satellites, more in the range of anywhere from 10 to around 10 megabits per second. So it's like 110 connection. But that's pretty incredible speeds for a satellite connection, and they tend to be quite a bit lower latency. So where we were having about 700 milliseconds of delay on a standard satellite, which is about 3/4 of a second one way, we have about 50 milliseconds of delay on a low Earth orbit satellite, which is less than 1/10 of a second. So these are much faster, much lower latency connections that are available, and they're a new technology. Some of the challenges we have with low Earth orbit is the same thing that we have with fiber. These constellations are being built. There's thousands of these devices that are up now, and we're starting to have pretty robust networks of these low Earth orbit satellites, but they're not fully deployed yet. Not every community is served equally. But once these networks are up, really anyone anywhere in the world should be able to look up in the night sky and see dozens of these satellites and have pretty fast internet connectivity through these satellites. The last type of internet connection that we want to talk about, and there are, in certain instances, this is considered broadband. In certain instances, this is not considered broadband, but it's an important one for us to talk about is cellular connectivity. So cellular connectivities can provide broadband speeds either at the device level or using a cellular modem. So if we're using a cellular modem which uses the same kinds of SIM cards as you use in your phone, maybe multiple of these SIM cards so that they're using multiple circuits, cellular circuits. They're able to pull down really fast speeds of up to gigabit speeds using kind of the latest 5G technology. And these are ubiquitous. They're everywhere. So everyone has a cell phone. Everybody has a data plan. And I say that, but there are one of the challenges we have is not everybody has them, but these are very, very common. And in a lot of situations, if we're reaching out to patients or if we're reaching out into communities, this is the connectivity that a lot of folks will have. They may not have a broadband fixed internet connectivity that comes to their door, but they will have their mobile plan. They will have connectivity through that phone. So what are the challenges with this? It's a very common way for patients to connect. We have 4G and 5G connections that support really fast speeds. The issue with these is there is a lot of variability around these data plans, around the cellular connectivity that we have to take into account. One is that cellular connectivity, the strength of these cellular connections will grow or weaken depending on your distance from the tower, depending on the coverage amount of towers that are in your area. So, you could be in one place in a community, have really good connectivity, really fast speeds from your cellular connection, and then if you drive to another community, all of a sudden that same network, the same connection that you had in your phone is nowhere near as fast, nowhere near as robust, and is more prone to fail. The other thing that we see is a lot of cellular connectivity. There are still plans that are charging per gigabit. So the actual amount of data that you're downloading or the actual data that you're streaming or using on a video call can actually be tacked onto your bill. And so once you hit a certain amount of data, you could actually be paying overage for these, and especially for lower income or for folks where you're having to choose between connectivity and other things that you need to continue to live. Those expenses, those overages can become really, really detrimental. The other thing that tends to happen on these plans is that even if you have an unlimited plan, the ISP or the cellular provider, once they see you hit a certain amount of data, they can throttle your connection, where you could go from having 100 megabits per second connection, and then once you hit that data cap or that throttling cap, they can actually reduce your connectivity to 10 megabits per second. It's just an example, but we also see this as well, so that you can go from having a pretty fast connection, but then once you hit a certain amount of data that you've used, that can be throttled. So there's a lot of budgeting that kind of has to happen around the data for these plans. So that gives us kind of an overview of the different ways that we can connect, the different infrastructure that's out there that supports broadband. But let's talk a little bit about why. Why does this matter to us? Why is this important? And we're going to give you a couple examples of kind of what the infrastructure looks like for connecting for digital health. But I want to talk a little bit about the impact that this has. So broadband really is fundamental to what we're trying to do in digital health. We have to have stable, fast, high quality internet connectivity to create the opportunities to deliver digital health. So good internet is really helpful for when we need to deliver just-in-time care. So, whether that's behavioral health, emergency consultations, urgent care, people in crisis, they need to be able to connect when they need to be able to connect. And so having good connectivity that's delivering consistent speeds and that is not being throttled by ISPs or plans, that's a vital element for digital health. Good internet connectivity allows us to provide digital health services wherever the patient or wherever the provider is needing to deliver them from. So that could be in a home environment, that could be a work environment, that could be a school, anywhere they are. Now, that comes with its own set of challenges because, if we are a provider delivering healthcare, there are things that we need to make sure of, that we're not delivering telehealth from the beach, that we're not in places where we can be overheard. So it raises privacy and security concerns, not only from the provider side, but also from the patient side, making sure that we know that the locations that we're delivering care to are secure, that we're doing what we need to do to make sure that we're maintaining the privacy and security of those locations, and the reliability of those networks. So we all know that if we are doing these telehealth visits and we're on the move, we're switching from tower to tower, for example, and for cellular connectivity, that just increases the ability, the likelihood that that call is going to drop, that we're going to have a bad outcome, we're going to have a bad connectivity. So we want to make sure that we're getting the care where it's needed, but we're taking the steps we need to make sure that that connection is solid. We consider our broadband connectivity, it's just a prerequisite of telehealth. The image here that we have is, these are the 4 pillars that we kind of build telehealth on, right? So we need to have access to providers and services. We need to have access to devices that can access the tools that we need. We need to make sure that our providers and our patients are digitally literate so that they can actually access the services, they know how to use the technology, and that they have equal opportunity to get the benefits from being digitally connected. And then the 4th pillar, that 4th leg of that table that supports telehealth, is connectivity. Without connectivity, we can't do any of the work that we want to do. And finally, good connectivity is it gives us the ability to enhance care, gives us ability to access resources, it gives us the ability to provide services to locations that we otherwise couldn't do. So I wanted to kind of provide a little before and after. Before, I'm going to go back. Sorry. So those are kind of the philosophical reasons why this matters. But I do want to give a couple examples of what are the sorts of things that we can do with a stable, high-speed internet connection. Well, we can provide video visits, including telebehavioral health, primary care visits from a patient home to a clinic. We can provide consultative services from a clinic environment to a hospital environment. We can provide individual video conferencing or group video conferencing, where we're bringing in family members or we're bringing in other specialists. So we're able to do not just one participant on a video call, but we're able to support multiple video call, participants on a video call. We're able to provide store and forward telemedicine, where images are sent and reviewed, and recommendations are sent back either between providers or between patients and a provider. We're able to provide support for remote patient monitoring using connected devices like glucometers, blood pressure cuffs, weight scales that all need to report this information to wherever this information is stored on a cloud or in the EHR. We're able to provide robust hospital home services where we're able to monitor SpO2 and vital signs, and we're able to do telehealth visits and actually keep patients outside of the hospital and actually deliver these high acuity and detailed medical visits directly to the patients at home instead of having them stay inpatient. We're able to access our EHR when we need it. So getting access to records, images, notes, so that we can actually deliver care from really anywhere that we're able to access these resources. And finally, we're actually able to pull in patient information like fitness tracking or data that they're collecting on their mobile devices, or glucometers, or all the other ways that we collect digital information and store it and send it and review it with our providers. So the next section here is, I wanted to do something I like to call, well, I'm doing it for the first time. So I want to call this a tale of 2 telehealths, right? And I want to kind of draw a contrast between the way that we used to do telehealth and the way that we're doing telehealth now, and to show why the connectivities that we used to have are not really up to the challenges that we're not up to the challenge that we're they're not meeting the needs for the telehealth that we're trying to deliver. So this is the way that it was. This is the way that it used to be. So typically for a telehealth visit, and we're going to confine this to talking about video conferencing to video visits. So the way we would connect for a video visit is we would have a dedicated cart endpoint, or we would have a dedicated video conferencing platform. It did one job and one job only, and that was to do video conferencing, and it connected to the internet. Probably connected to a dedicated internet connection, maybe a subsidized line that was maybe either specifically for telehealth or at least just for medical. It was just subsidized for that clinic or for that hospital for medical care. All the traffic was handled on site through on-premises servers. So the connections were actually happening locally within the organization. All the hardware was integrated into the cart. So if you had an exam cam that was plugged in and hardwired into the device, it was all running custom software just to do the one job it was, which is to conduct video conferencing. And then we would have staff on both ends. So we would have the clinic with the cart, and it would be connecting to the hospital with a provider that might have a video cart there. And this was a kind of a one-to-one relationship with really well understood endpoints and really well understood connectivity. So that's the way it was. So what is the way it is now? So we can take a look at this and we have a much more complicated view. Over on the right-hand side, we have providers, and the provider might be connecting from their home. They might be connecting from a clinical environment. They might be connecting from a hospital location like we've seen before. They are needing to access patient data through a cloud. So that might be EHR data, that might be radiology, that might be lab resources. So we need connectivity that will actually support and that we can actually use to connect to that cloud, more than likely through a virtual private network, so that we can make sure that that PHI data is being secured. And so that adds a certain amount of overhead. Then we're actually connecting from these locations through the internet, through cloud-based services, to the patient and their location and wherever they are. And I put patient location and not necessarily home, just because there are a variety of different locations that the patient could be connecting from. They may not have connectivity, so they may be connecting from a library. They might be connecting from their mobile phone on a cellular network. From work, they might be connecting from a work computer. They might be connecting from a laptop. They might be connecting from a tablet. But we connect to the patient through their modem. That goes to their router. Their router actually provides connectivity for whatever the location is, and a variety of different devices can connect to it. So the way it is now is, instead of having these dedicated telemedicine platforms, these dedicated video conferencing platforms, we have general devices. So the phone or the tablet or the laptop that we're using can do 30 different jobs and not just the one that the previous device did. Most of the software that we're running is web hosted and is consumer software, rather than being kind of the dedicated software that for healthcare that we had previously. And so that requires a lot more back and forth through the internet to the resources that we need, and then back. We have a lot of telehealth peripherals now that connect to their own cloud storage. So they're actually connecting with their cloud and then maybe connecting back to our EHR and sending that information kind of through that loop. We have various provider locations that we're supporting. So we can just see the way that we're doing our telehealth now is different. Are there advantages to doing it this way? Absolutely, there are. And that's the reason why we do it this way. The platforms that we're connecting to, the video platforms, they're a lot more accessible. They're easier to deploy, easier to scale, easier to get access to the patient home. We weren't even considering reaching patients in the locations that they were before. And now we're actually able to do that because of the ease of using these tools through the internet, through these cloud infrastructures. We're not having to support all this infrastructure at the hospital, at the clinic, at the provider's house. We're actually able to offload a lot of that to cloud providers that are actually able to do this for us. So, so let's take a look at these two tales of telehealth. So the way it was is we had specialized hardware, we had dedicated networks and circuits. It was expensive to buy this equipment, to maintain it. The way it is now, we have generalized hardware. We have laptops, we have tablets, we have phones that can be running a variety of different softwares, doing a bunch of different jobs all at once. And these, we are running shared networks and circuits. It's going on the same traffic as everything else, especially when we're reaching to the patient's home location. There could be YouTube going on, or games that are being played, or schoolwork that's being done. So we're on these more congested networks. But all of this is quite a bit more affordable than it has been. So the cost for more speed, the cost for more access has gone down. The way it was difficult to upgrade and expand these telehealth systems once we got them. So we would end up with these carts that we would have to support for years and years, and the maintenance costs and the cost to maintain the software was become really, really expensive and onerous. And so sometimes these carts we would just stop using them. They would end up covered with dust. But the advantage would be they were local. We had them on our networks. We were able to manage them. But the disadvantage was they were local. And so we knew the endpoints that they would be, we knew the locations they would be, and they could only be in those locations. What is it like now? Well, it's easier to upgrade and expand our telehealth capabilities through software, through web-based applications, and through consumer-grade hardware. It's harder to manage that hardware, so to know where it's at, to know the environment it's going to be interacting from. But this makes us a lot more location agnostic. So we can do telehealth from a variety of different locations, from a variety of different connection types. So all of this to say that there's a couple key takeaways I want to make sure that we're pointing out here, just so that we're understanding is we've gone from really emphasizing the importance of institutional networks, these subsidized healthcare connections, making sure our clinics and our hospitals and our schools and our libraries have connectivity, to understanding that these these residential networks are actually where a lot of the value for some of the telehealth things that we're doing is being delivered. So we need to be able to have good connectivity both in and out of these home locations. We need to be comfortable and familiar with connecting to personal devices. So particularly when we're reaching out to the patients. So making sure that we can navigate their wireless environments. We understand the cellular plans, understand maybe the burden that we're putting on patients they might, if they have cellular plans that are expensive, or if they have data caps, that we are kind of recognizing that cost, and maybe that we're offloading some of the costs that we used to support in our clinic to clinic, but we're actually putting some of that data cost on the patient now. We need to understand the importance that we are working on a variety of different types of hardware and software configurations, and that sometimes that can create challenges. And then we need to understand the importance of digital literacy. So it isn't that we would connecting one point to another and it's just a single button that you push and that you're in the call. We need to make sure that everyone is comfortable using the technology. Everybody understands how it works and why it works. And then we just need to embrace the challenges that we're going to have managing all of these variety of different endpoints. There's more endpoints. They're in more varied location. This is kind of the new normal. All right, so I do want to talk a little bit about the state of broadband in the US, and then some tools that are being used to kind of identify some of these residential gaps and kind of how we addressed it. There's a lot of question over how many people in the United States actually don't have broadband access. So we've got a variety of different data sources. The FCC has data that says, yeah, it's about 15 million. And actually that number's gone up since they've changed the way they were measuring. So this was based off the 25 and 3 download speed. So now that we're dealing with the 100 megabits down and 20 megabits up, this number actually increases. So more people that were in that 25 and 3 now don't have the 100 down and 200 or 20 up. So there's more underserved. But some other organizations actually indicate that the speeds reported by, or the access reported by the FCC data is probably not counting everyone else, because for a variety of different reasons, and we can talk about that in a little bit. But Broadband Now reports that that's maybe closer to 42 million. Microsoft back in 2020 did reporting where they actually measured the speeds based off of the updates that people had to run from their computers and devices, and actually indicated based off the speeds that these updates were being downloaded by, it could be closer to 120 million that didn't have access. Now, these numbers have gone down and are continuing to go down significantly year over year as more and more fiber gets deployed, as more and more broadband access is moved out to more and more rural locations. But it is a problem. The other big issues that we have to address is that historically and rural and tribal America lag far behind the rest of urban America in getting access to broadband and having access to affordable connectivity. But we also see even in urban areas, affordable connectivity actually limits the ability of folks to access care. And the key limiting factors there are the ability to access the services and how much the services actually cost. So we have to kind of consider where these services are being delivered, and then how much the actual connectivity is to access these services. So an individual may be able to access a gigabit plan, but if they can't afford to pay for it, it may mean that they have to go to a DSL connection, or it may mean that they have to go to their local library to actually connect to telehealth services. And so being aware of that. And the problem is that this lack of digital access is actually reinforcing a lot of the same social and economic disparities that are already prevalent in our society. So this digital gap, this digital access gap, is actually could exacerbate a lot of the other social inequality issues that we already have. What else has changed? We've had unprecedented investment in broadband across the United States. The first thing we have here is the Affordable Care Program. So this was actually a program that actually gave money or a subsidized internet connectivity for individuals, for consumers, and actually helped consumers get devices. So this program was funded through the FCC. Funding for that, $14 billion that was funded for that initially, was actually all spent, and then that actually ended June 1st, 2024. So this program is no longer there, but it was a major investment for consumers and trying to help consumers access affordable connectivity. Some ISPs have actually continued to deliver the services for former Affordable Care Program members at those reduced rates, just kind of with them eating the subsidized cost, because they've had more people actually sign up for these services, and in order to maintain these services. Another major source of funding is the BEAD funding. BEAD funding has the goal of improving broadband access, affordability, adoption, and equity. There's been $42 billion that has been used for broadband expansion. There's been 56 eligible entities. These are states, territories that have applied and had broadband equity access and deployment plans, BEAD plans, and then funds are in the process of being finalized and approved, and dollars will soon beginning to roll out for BEAD deployments. Another big funding source is the Digital Equity Act. This is focused more on making sure that access to digital resources is equitable. So this could be device access, this could be digital education, making sure people know where and how to access these resources. So this is actually in the middle of rolling out. Each state has been given money to create a digital equity planning grant. Each state has also been given money to, or has approved plans to receive capacity grants to improve their digital equity according to their digital state plan. And then right now, actually opening in September, I believe, there are a variety competitive grants that can be applied for to get money for non-state, for non-government organizations to provide digital equity opportunities, trainings, making sure that we're whatever we can do to reduce that digital equity gap. Look at my notes. There's a flurry of frenzy of the program. Broadband USA is holding a variety of webinars. This is open to a lot more stakeholders than the state and government funding. Again, submission date September 23rd, 2024. Broadband USA has a lot of information about this if this is something that your organizations would be interested in participating in. It's been a lot of effort around measuring the gap in connectivity. There's a couple maps I want to point out here. One is the FCC broadband map. It actually is two maps that are overlaid with each other. The fabric map is just a measurement of all. It's a map of locations. So like, what are all the endpoints that we could potentially be delivering connectivity to? So what are all the houses? What are all the people that we could serve? And then overlaid over that fabric map is the broadband availability map. And this is ISP reported data around the services that they offer to those locations. So the fabric map is the locations, the broadband availability map is the services that ISPs give to those locations. The second map that we have here is, so the FCC broadband map just kind of shows potential. This is the potential for connectivity in these communities as reported by the internet service providers. The map below is broadbandmapping.com. This is using public data sets, public speed test data sets. So Ookla and some of the other public speed tests that people can take, and actually mapping that to the geographic location. There's a few different maps that do this sort of mapping, but this one is filterable by ISP. It's filterable over time, and you can actually see kind of what these actual speed tests are and kind of where they're landing. I want to take a few minutes and talk about a program that TTAC has been working on. So this is the Telehealth Broadband Pilot Program. This is a HRSA-funded grant that we have been doing for the last 2 years. Our focus is on 4 states: Alaska, Central Michigan, Alaska, Michigan, Texas, and West Virginia. And then within those states, we have 20 different counties that we've been working with. We've been working in partnership with an evaluation partner, which is the University of Arkansas Medical School, their Rural Telehealth Evaluation Center, RTEC. They are in charge of actually processing the data and looking at the data that we're collecting and generating reports and trends and findings from that data. And then we've been partnering with Exactly Labs, who is the software development for the tools that I'm about to show you. But before we get into that, why are we doing this? So when we think about the internet, we think about it as a light switch, right? Either you have internet or you don't have internet. And the premise that we had is that internet's not binary. It doesn't just flick on or flick off. In reality, it can flicker. And so we could have outages, or we could have slowdowns, or we could have latency spikes. And when that happens, we generate friction in care, friction in telehealth. So maybe a provider's not able to access the EHR when they're talking to the patient. Maybe a video call fails. Maybe audio is garbled, so we're not actually able to listen and hear. Maybe a telemedicine tool, exam camera, we're not able to get the images from it. So how do we measure that flicker? How do we capture that flicker? So one of the things that we're looking to do is we want to be able to test not only in a moment, which is a lot of the speed tests that we take. If we think we're having a problem, or if we want to know, like, how fast is my internet? We Google speed test, we take a speed test, and that's great. That's a snapshot. But how do we get the movie of what our internet's doing? And so the Telehealth Broadband Project actually built pods, and these are built on a standard microcomputer, a Raspberry Pi, loaded with our testing software. And we run 2 tests. We can run it with a lot of frequency. So we can run hourly tests. We can run 15-minute tests. We can run tests we can run lots of tests over any given period of time. And what that does is that gives us the movie of what actually is happening in connectivity, and it gives us that movie down to a really granular level, to a network level, rather than a house or a zip code or a census area. So here you can see some of the pods that we've deployed through the state of Alaska, some of the data that we're actually able to collect from this, and we're able to draw some interesting conclusions and some trends from this. Some of the other tools that we've actually built through the program is an embeddable a speed test widget. You can actually put this onto a website and actually just run speed tests. Again, get those snapshots, but we can actually embed this into any website. And we can actually actually collect that data at that for a particular group of people. So if we had a particular project that wanted to be able to collect speed tests for that project, something that we can do. And then actually report back on that data, map that data over time using that speed test widget. We also have a mobile app, and this one does some interesting things for us. One is it allows us to just do a speed test kind of on demand. But the other thing that we can do is we can actually put this into, we call it background mode. And what it actually does is it starts to measure cellular connectivity, just like one of our pod beacons. It can do it at an hourly level, or it can do it at a 15-minute increment. And so when we have that cellular connectivity and we're able to run these cellular tests over time, what we can actually do is drive around a community and map out what that cellular networks look like. Where are those dead spots? And so it's a little hard to see on this map here, but you can actually see this is a trip that was done from Anchorage down to kind of the Homer area. And you can actually see the gray little dots are where that internet connectivity actually cut out. And so we're actually able to map these dead zones, and we're able to map where the internet came back, where it's strong, where it's weak. A couple key trends we found with the TBP is the challenges are maybe not what we expected when we started looking at this. Some of the things that we're finding is for some folks that are testing their internet, they feel like they have bad internet, and we're actually measuring that their internet might be okay. But what the challenge is there's something happening kind of beyond the internet that's being delivered to their door. So it might be older equipment, it might be an older router or an older modem. So one of the things that we're looking at for interventions is how do we verify kind of what the technologies are that they're using past the internet connection being delivered to their door. So a lot of times we can actually have these individuals go back to their internet service provider, get a new modem or get a new router, and they're all of a sudden they're getting speeds much closer to what we're advertised. Some of the other challenges that we've seen is around micro outages, where internet will kind of go out for a short period of the day, and it may last a minute, may last 15 minutes, but it's kind of unexpected. And so the users aren't sure whether that's happening at the ISP level. They're not sure whether it's happening at their network level. But if we've actually got multiple of these pods in a location, we can actually see, is that an ISP outage, a micro outage, or is this something that's happening just for this user? And if it's just for that user, it might be something that's happening in their local network. They may need to reset their router. But if it's happening with multiple, it's probably an ISP. And these little micro outages are, they really can be impactful if that's when you're doing your video telemedicine, if that's when you're trying to do your care. Those are friction points that we talked about. I wanted to leave you guys with some resources. So so we've laid out a lot of information for you. I think we've talked about why it's important that we're talking about telehealth. But where should we go? So there's a variety of different resources here. I'm not going to belabor these. The only one that I want to talk about is these broadband nutrition labels that the FCC is putting out. They've actually made a requirement for ISPs to provide these nutrition labels for each of the plans that they offer. And this is a really great way to pair with other testing tools to say, are you getting what you expect to get from your ISP? So you can take a test, look at this nutrition label, and it really gives you some actionable information as to, like, yes, either I'm getting what I need to get, that it's probably not an issue with my ISP, or no, I'm not getting what I need to get. I need to have a conversation with my ISP as to why these numbers aren't matching. And it gives you a tool to really know what you're supposed to be getting and knowing if you're getting it. And I do just know we're kind of at time. If you do have questions, please visit us at the telehealthtechnology.org website. You can submit your questions in through there. I'd love to talk with you guys more about this. Obviously, I'm passionate about it, and it's something that we really are diving into with our telehealth broadband project.
Thank you, Jordan. We are actually at time, so we don't have time to answer those questions in the Q&A, but I will make sure to forward you those after the presentation. And if you have any questions, you can always contact the TTAC at telehealthtechnology.org. I'm just going to bring up our closing slides here for today. Just a reminder that our next webinar will be held on Thursday, September 19th. That will be hosted by the Heartland Telehealth Resource Center, and that will be on expanding rural access, key insights from implementing telehealth access points across Oklahoma. Registration is available on the NCTRC events page. And then lastly, we do ask that you take a few short minutes to complete the survey that will pop up at the conclusion of this webinar. Your feedback is very valuable to us. Thank you again to the Telehealth Technology Assessment Center for hosting today's webinar and to Jordan for his presentation. Have a great day, everyone.